Welcome to Inspire London College. This is the assignment worksheet for Qualify Level 3 Diploma Understanding Stroke Care with the unit number A6153828. Now in this video, I'll guide you that how can you meet the requirement of each assessment criteria and learning outcome of this unit. Now, here comes the introduction in which you have to provide a brief overview of the topic of your assignment, that is understanding stroke care, in which you can discuss like what stroke is, what is the definition of stroke, and what is the prevalence rate of stroke. So this is all you can discuss under the introduction section. Now, here comes the assessment criteria 1.1, in which you simply need to explain the different types of CVA, that is cerebrovascular accident, which is also called as stroke. So you just need to explain what different types of stroke are. For the assessment criteria 1.2, you need to explain the signs and symptoms of a stroke, because stroke can occur or happen at any side of the body. So you have to explain the signs and symptoms for both the left-sided and right-sided CVA. Whereas for the assessment criteria 1.3, you need to first identify and then analyze the causes, which are basically the reasons for the appearance of different signs and symptoms of stroke. But make sure that you provide these reasons in terms of physiology of the brain. And for this, you have to understand the physiology of brain as well, especially how the left and right side of the brain is responsible for controlling different functions of the body, in which you can understand like how disruptions in any part of the brain can impact are responsible for the appearance of different signs and symptoms of the CVA. Now, for the assessment criteria 1.4, you need to discuss the effects, which are basically the impacts, or you can say the consequence of the CVA on an individual's life, on an individual's body, on an individual's health. So these are all the consequences or the impacts of a disease like stroke on the individual. Now moving to the learning outcome 2, in which for the assessment criteria 2.1, you need to describe the risk factors that are associated with the stroke. Like what are the risk factors that are playing their part in the occurrence of the stroke within the individuals. Further, you also have to explain or provide the strategies that can be used in order to prevent these risk factors, or in order to reduce these risk factors which become the reason for the occurrence of CVA within the individuals. So in assessment criteria 2.2, first you need to identify different clinical investigations that can be used by the doctors or the care professionals in order to diagnose stroke within the individuals. And then you have to make a comparison as well between these clinical investigations in order to discuss like what these tests are, how these tests can be used, what are the results of these tests, and how these results can be used in order to diagnose whether the individual has CVA or not. Whereas for the assessment criteria 2.3, you need to assess the strengths, which are basically the positive points or the advantages of these clinical investigations that you identified under the assessment criteria 2.2, and then you need to explain the weaknesses, which are basically the disadvantages, or you can say the limitation of these clinical investigations that are used for the diagnosis of CVA. Now here is the learning outcome 3, in which for the assessment criteria 3.1, you need to describe the acute care post CVA, and then you need to explain and provide detailed answer what is long-term care post CVA is. Then for assessment criteria 3.2, you need to explain first what is rehabilitation team, then you need to identify the team members that are involved in the rehabilitation team, because you have to explain the roles and responsibilities of each team member that are the part of rehabilitation team. And you also have to provide an explanation like what interventions these team members are used, like what action they are taking in order to cure the disease like stroke within the individuals. Whereas for the assessment criteria 3.3, you need to evaluate the effectiveness of care in a specialized stroke. Now what does it mean? That you have to explain what is the effect if an individual is receiving a specialized care in a stroke unit in terms of achieving positive outcomes for his recovery from the stroke. So this is how you can discuss, you can explain or provide reasons against the assessment criteria and learning outcome of this unit. And you also have to provide a brief conclusion to the topic of your assignment by summarizing the key points of your assignment. And you have to provide the references of all the sources as well in the last section of your assignment, that is bibliography. So this is all about the assignment worksheet of Qualify Level 3 Diploma Understanding Stroke Care.